Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 55 minutes to an hour or so discussing the means that people in the Medicare space have to continue to write business all year round. And this is through the use of special election periods that are available to us through legislation passed by the government. It's a great way for us to take care of the vast majority of people that quite honestly didn't review their plans during the annual election period. Today's presentation is being recorded, and that presentation's recording will be available on our website at premiersmi.com and also on our YouTube channel as well. For folks who have expressed interest in today's presentation, an email will be sent with a link to that presentation and additional information on some of the studies and other things that we reference throughout the course of the presentation. And so you will be receiving that as soon as it updates in the system. One of the things you'll see too in the software system is there's a section for both questions and chat. We ask that you put your questions in the question section. We find that in most cases we do answer those through the course of the presentation, but we want to make certain we get you the information you need to get full value out of today's presentation. One of the first things we'll do, however, then is give you a bit of a level set as to who Premier is. Most of you on the line are very familiar with us. Some of you are not, but we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. And we have offices across the country, licensed and contracted in all 50 states. And we act as an insurance wholesaler working with independent insurance agents and agencies such as yourself. We do so through contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. Today, in addition to the voice emanating from the bearded fellow on the bottom, we have Brandy Hake with us today, who's the Vice President of Agent Success here with us here at Premier. And we thank Brandy for coming on and helping us explain some of the special election periods. You'll also see that we offer our programs through a full portfolio of product. So in addition to the Medicare programs with Medicare Advantage and Medicare Supplement plans and the standalone Part D prescription drug programs, you do have a full portfolio of life insurance and final expense products, pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits that fill the holes in the base medical portion or add to those coverages with such programs such as dental, vision, hearing, critical illness cancer plans, hospital indemnity programs, accident programs, and even telehealth plans. That Medicare Advantage portfolio has the national carriers there for you through our organization, in addition to many of the strong regional programs that can make a difference for you in your market. And that philosophy carries over into the standalone prescription drug plans, where in most cases, these are available to you as part of the contract that you complete for the MA plans, but we want them out there for you to see that they are available through our organization. We do also have a very large and robust portfolio of Medicare supplement plans. We find it important to make certain that you have at your disposal plans that appeal to people across the spectrum of Medicare beneficiary needs. And so in addition to these programs that are out there, we also have special support programs to help you be successful in this space as well. When we speak to those ancillary products directly in each of the categories, you have the national leaders that are there for you. They serve, as I mentioned, not only the purpose of taking care of that additional need that many of your prospects and clients have, but also can act as additional marketing means and, of course, another means of creating a revenue stream for you and your agency. When we speak to the Medicare market, for those of you that have just come through that hectic annual election period, you're well aware of many of these numbers, but you don't come on a presentation like today without hearing about the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. But if you look at Medicare based just on age, hey, it's an exponential growth nearly, but you also have a larger number of people that are continuing to work past the age of 65 for one reason or another. Maybe they just like to work. Maybe some of them are delaying their retirement because of, well, hey, the tail end of the baby boomers, you got to be past 65 to get full Social Security benefits. Whatever the reason may be, it kind of tones that number down from this slide, but it goes back up rather quickly when we consider the fact that 15% of the Medicare population are under the age of 65 and are there because of medical disability, and they more than make up for that number. So we've got a huge market here to deal with that has special needs. No pun intended for the specific type of Medicare Advantage plans, but you see that 2/3 of the Medicare population have 3+ chronic conditions. So it's important for us to have the plans in play that can help them deal with the cost of dealing with those conditions. We also have a median income that's, well, it needs some help. If we don't have budgetary programs put into place to help with some of those health conditions, population's in trouble. A little later survey of income shows them at 26,120, but you still have income and savings challenges, and we want to make certain that we offer them the protection that they need in whatever choice they make. Because when a person comes on Medicare, well, the first thing they can do, they can actually defer or decline the Medicare Part B coverage, the medical portion of standard original Medicare. Thankfully, most don't. Some will consider other means of, well, maybe I'll self-insure for the medical portion of it, and I'll pick up a standalone Part D program to take care of or help with the cost of prescriptions. Some will then look at that and say, hey, I need something else to fill the gaps. They'll go with a standardized, modernized Medicare supplement plan to take care of the shortfall in the base medical cost. And others, to go off on a cable TV show, they bundle their coverages into Medicare Advantage plans, the Part C programs, or as you heard on the commercials on television incessantly over the last few weeks, an all-in-one plan. And these are the Medicare Advantage plans that are offered by private insurers through a contract with the government. So in each of these instances, multiple ways that they can have base coverage or whatever it happens to be, we need to make certain that we can help them with our portfolio and understand when we can do so as well. And that's the purpose of today's presentation. You'll see that people that when they're first coming on to Medicare, be it late to Medicare seniors or those that are aging in, you saw in the past a pretty even choice distribution between Medicare Advantage and Medicare Supplement plans, with some still showing an original Medicare. We need to make certain folks realize that original Medicare in this case could be a Medicare Medicaid beneficiary. It could be someone accessing care through the VA. It could be someone who has retirement coverage from where they used to work, or the folks that have made the decision to make a decision and stay on just traditional Medicare. But what we have seen through an influence of the pandemic is that those numbers are a little skewed. More people enrolling in Medicare Advantage than they had in the past, and a little bit fewer in the Medicare supplements. Regardless, we need to make certain that we address that trend, or if it reverses, do we have the product in play to help it take care of the need, and also make certain that, hey, that might not stay the same. We got to be aware of what we need to do and what we have to offer the folks. And that includes translating some of the language that's out there. Every industry has their own jargon. We find ourselves as agents sometimes falling into the habit of using acronyms, which is something we need to stop doing. But sometimes we don't always understand what some of those acronyms are ourselves. And this guide will come to you as a link in the follow-up presentation, so you have it available. And it's one of those that, hey, I've been doing this for over 30 years. Every now and then one pops up and I'm like, what does MOUSE stand for? Well, this doesn't have it in that guide, but the other acronyms are there for you. We stress the use of these special election periods and knowing what the standard election periods are, because we're being told by Kaiser Family Foundation that the vast majority of people did not compare their plans in some of their most recent data. And we haven't seen a real uptick in this as much as we'd like through the pandemic and some of the emphasis on more electronic distribution of information. So all the folks that are on Medicare, even those that may be in your book of business as either enrolling with you or not, That's the folks that are actually comparing programs. You see a large percentage that don't, and it is particularly influential in the more vulnerable parts of our population. The carriers out there are really stressing some of the dual special needs plans, and these people are some of the folks that are very much affected by the fact that they didn't do an annual comparison of tools, and they're not using the tools that are out there, be it in embedded the prescription benefit into the MA plan itself, or if they're talking about a standalone program. So across the board. So many times a Medicare supplement agent, to paraphrase or generalize a description, may not have done reviews on their med sups because, hey, for one reason or another, those are folks that aren't doing the annual evaluations, and we know how the cost of drugs can change. The formularies can change in the plans, be it however they're being accessed. Tiers could be changed. So we really need to look into that. The government actually does a pretty good job of making information available to the public, but once again, folks aren't using it. Be it the Medicare and You book, they either get by United States Postal Service or electronically. I'll guarantee the majority of these aren't read, and they're not using the app that tells them what's covered either. So across the board, lovely little presentations. They're not looking into some of the differences in the programs year over year, and we know that they need to. And we know that if we are able to deliver information to them, either in person or electronically, or going back and forth, an in-person presentation, a virtual follow-up, or the other way around, we can get them the information they need to make a solid decision as to their coverage throughout the year as well. And they've been trained to do so. The Medicare population across the board. They're much more digitally savvy than they were 2 years ago because, hey, for a year plus, that's how they went to the doctor. In many cases, you saw the hospitals using digital means to speed up the process there. Dentists use it. Faith-based organizations held their services online. So we have a much more learned audience to disperse our information. Our trick is to make certain that we're able to do so compliantly and deliver upon it completely and do it in a manner that helps us across the board help these individuals. And as we go through the different needs that they have, we realize too that as we discuss their base coverages, it reveals that need for some of those ancillary products or other things they may not have thought of. Refer to one of our previous presentations as to what Medicare doesn't cover. But the more product we have in the house, the better your retention is. Persistency goes up. And the studies show it doesn't even have to be plans with the same company, just the same agent, you. And so knowing about how to take care of people with special election periods can make a huge difference for not only your prospects and clients, but you and your insurance practice as well. So as we speak to the different special election periods, let's consider first how these affect some of the base coverages that are available to you and your audience in the Medicare world, because you almost have two different categories. And you'll find this a lot of times as folks discuss, well, hey, Medicare Advantage folks will say, why would you ever sell a med sup? I mean, there are programs there without premiums. And then you'll have some Medicare supplement people that will say, why would you sell anything that has a network constraint to it? So we have to be aware of the fact that our personal feelings on this may influence some of what we deliver. We need to make certain that we're delivering the message across the board as to choices and making certain that they're eligible for one thing or another. We also find that those differences go into what we're able to do when it comes to marketing, how we have to contract, do we have to certify, what is subject to different enrollment periods, because Medicare supplements aren't. You can cold call, you can door knock for med subs. But if you do that, you have to be aware of what you need to do to pivot to the other side if necessary. And can you offer a program throughout the year to that individual and make certain that you're doing so compliantly? So you get into different licensings and certifications as well. The carriers do a pretty good job of laying out information as to what you can do when. This is a piece borrowed from United Healthcare's Medicare and Retirement, and it speaks to the standardized election periods and the SEP periods that come into play. It speaks to the differences between those programs as well. I'm not reading through all this, but you'll have this that will come to you as part of the follow-up, of course. But those basic election periods, hey, everybody's taken that deep sigh of, wow, AEP's gone for a week. We have another however long before it starts up again. And we have then the OEP period that's there that we can't market to, but is there for us, and all the different special election periods that come into play. And sometimes folks will go, gee, they're locked in, nothing we can do. Well, yeah, the standard SEP chart has 20 different SEPs alone. The majority of people on Medicare will qualify for one or another. It's a question of, is it in their best interest to take advantage of these SEP codes? And do we know how to use them as part of our marketing piece? So it's at this point in time, we run into those extras too. This is a representation of the 2021 weather-related special election periods that include a number of other things. And this is where I'm going to ask my partner in crime, Brandy Hake, to come in and tell us a little bit about these special election periods and how they come about, that sort of thing. Brandy, if you would.
Yeah, hey John, definitely a pleasure to be joining you today and discussing more of a broad spectrum of these special enrollment periods. Appreciate you having me on. Like you mentioned earlier in the presentation, I'm Brandy Hake, VP of Agent Success here within Premier. More so sliding into my 13th year here, so I've always had more of a passion for election periods, providing proper guidance, opportunities, education, just outside the actual annual election period for agents to be able to leverage more business. Today, I just really wanted to hone in on the SEP FEMA. Left and right, we're getting emails and communication from CMS companies about opportunities out there in specific counties and markets where that's going to arise here. So next few slides here will be information coming from Humana. I'm just going to highlight on a few things on how, who qualifies, what this means for you guys as agents, and we'll kind of go from there. So I'll make it short and sweet, but who qualifies for this SEP? Really, about a year ago, effective January 1st, the SEP exists for individuals affected by a disaster or other emergency declared by a federal, state, or local government entity who were unable to and did not make an election during another valid SEP. So this includes both enrollment and disenrollment elections. And really what this means for you guys as agents, well, it allows you to conduct more business for those impacted. For those FEMA declared emergencies, consumers might be able to make the following changes fit to their needs. So you're really helping those clients out in a very difficult time. What it allows consumers to do, they can sign up for Medicare Advantage plans. They can switch a Medicare Advantage plan they might already have. They can drop a Medicare Advantage plan and return back to original Medicare. They can sign up for a standalone Part D plan. They can also switch a Medicare Part D plan that they currently have. Or they could just, return back to original Medicare and drop that Part D plan. So a lot of options there. And of course, compliance always comes into play. The SEP should never be used as far as a marketing tool to promote any MA or Part D sales, but rather as an awareness for the opportunity. It presents itself and consumers believe they have missed an election. Well, they're going to, rely on that agent to put them in the right plan. So for any updates or eligible counties for these FEMA declarations, I would tell you to consider Premier. I mean, contact us. We have the information at our fingertips. You can also utilize FEMA.gov's website. That's going to showcase and provide clarity on the different opportunities out there, broken down by counties and specific states. So with that, John, I'll turn it back to you and wish you guys a very Merry Christmas and a prosperous 2022.
Awesome. Thank you, Brandy. I think it makes us aware of the fact that much of what we encounter as to what you can do during OEP is present in these SEPs as well, but some additional things that Brandy highlighted are part of this opportunity to make people aware of they may be having another SEP to use to change their coverages. When we speak to the OEP period too, that's what we're entering into at the first of the year. And this is basically a period for handling MA programs, because to be in an MA plan, to use this, they have to already be in one. They can use it once a year through that first quarter. The folks that are in, they're just coming into Medicare through utilizing their IEP, initial enrollment period, they have this bundled to them as well. And it does not affect the Medicare savings account or cost plans. They aren't part of this. It's important to note that during this time period, the beneficiary can change MA plans. They go from MA to MA, or MA to MAPD, or MAPD to MAPD, or MAPD to MA. So this gives us an opportunity to help those folks that are in an MA option that want to do something different with it. This doesn't affect their PDP selection, so they can't switch from one drug plan to another, and it doesn't allow them to add drug coverage on a standalone program where they could under the MA option. It does not continue the annual election period though. So they can't join MA if they're just in original Medicare by using OEP, which is all right, because there's a whole bunch of different information out there from the different carriers that tell us how to use this coverage. Contrary to an occasional ad you'll see on social media or direct mail or whatever, you can't market to the use of OEP. This is Aetna's stance on that, and they have some wonderful support to help people deal with this time period. And if we see the commercials pop back up into on television with the quasi celebrities or wherever it happens to be that goes to, are you getting everything that you're entitled to, in a manner of speaking, you'll find that this may be one of the things that may be used to change a person's selection. We don't know what the call centers are going to do with it, but this isn't something we do on a general basis, be it through the information given to us by Aetna or by Cigna, and making certain that we are handling this program as it should be, because we're not even supposed to bring it up. They're supposed to, they being the beneficiaries. The thing is, there's so many SEPs that people can be eligible for, it doesn't really matter. So you have information that's being sent to you by all the carriers with whom you contract. You see information coming from us as well. There are some things that you can do, but it's through the use of the SEPs that we have referenced earlier in today's presentation, and make certain that we are handling the person's needs compliantly and in the direct manner, because the big boys all have their stance out there. Humana lays out their information. You're looking at some of the information right now given to us by United Healthcare. One of the things that we've seen over the last few years is an increased value of the producer help desk with all these different programs, where they can help you determine eligibility, not just for OEP, but the other special election periods, particularly when you get into some of the folks that are affected more by low income, where they can verify the different circumstances affecting that beneficiary. So you have tools available through your contracted carriers that can help you with this as well. So as we refer back to that SEP chart and going into 2022, we see it's important for us to make certain that we reach out to as many people as possible through compliant means, because as I mentioned earlier, the income dictates that they have the help. And so you'll see in a lot of the listings there that many of these SEPs deal with income and assets. And knowing about the entitlement programs or the extra help programs that are there for folks, and how those have changed over the last couple of years as well, that affects a great deal of this population. And for some people, they'll say, well, I don't want to deal with the very low income people. Well, LIS takes people up to 150% of federal poverty level. And so you'll see nearly half the population be eligible for an SEP, a special election period. I got to be careful about these acronyms too. And it can help you with these people. even if you are a Medicare supplement agent. I hate to label something there so broadly, but helping people afford their standalone Part D plan can really help you keep Medicare supplements in that household if that's your aim. So these are available for use once every quarter for the first 3 quarters, and then the fourth quarter, it's the annual election period that is there for them. A few years back, it used to be month to month, which could be a little crazy at times, but this is a program that we see, or a special election period, what we see a lot of people make use of. And these are also affected by different constraints that were put into this special election period to deal with the opiate crisis. So that is a piece where if the government sees that a person is using these programs to bounce from one plan to another more frequently, it's based on opioid use, they'll decline the SEP. So some things we need to be aware of. So where we had one SEP in general for low income, at part, it's kind of split up now. You don't run across it all that much, but we want you to be aware of it. And having people in these programs can make the big difference, because the value of the low income subsidy, sometimes referred to as extra help, it's thousands of dollars. And for folks that are heavy utilizers that don't have a means to really pay for these medications in any other way, it can really help them stay on the prescription regimen that is delivered to them by their providers and help them stay healthy. It also does a number of other things for these folks, where it provides access to prescription drug coverage they may not have had in the past. So these may be some folks that say, hey, I can't even afford a drug program. I most certainly don't want to deal with some of those costs or access, and they didn't pick up a drug plan when they were first eligible. Well, qualifying for extra help waives that late enrollment period, helps them with the donut hole, which hasn't completely gone away, no matter what some people think. There's still extra cost out of a person's pocket. It gives them that's quarterly SEP, and also can trigger applications for the Medicare savings plans, which help with the medical cost of a beneficiary's responsibility. So it does a number of different things for your prospects and clients, and gives you that SEP up to 150% of federal poverty level, where the MSP only goes to 135. When we speak to these Medicare savings programs, these are Medicaid administered programs handled in conjunction with the state. They may have a different label in the state that you operate in, but hey, different shade of lipstick on the pig, in a manner of speaking. The opportunity that is here that helps you really help the folks that need your assistance probably as badly as anyone, because these are lower income people. You see some different opportunities in this space than what you've had. There are 3 Medicare savings programs we run into quite frequently: the QIMBYs, the Qualified Medicare Beneficiaries. These are folks up to 100% of federal poverty level. The SLIMBYs, and the QI1s up to 15%, and then up to 135% of federal poverty level. Different benefits come from the different programs for which they qualify. But you will find that the folks that are in these categories haven't actually, well, a majority of them don't have the plan, these coverages in place, and they've been around for, most of them, over 20 years. When you do this, you have a different prospect client in hand, because you are delivering relief on cost to a population that doesn't have an entitlement mentality and are much more likely to give you referrals as well. We tend to flock together with the folks that we've, much like us, so they know other people that are in the same situation. A great way for you to get in front of people that you may not in the past. And pardon me a moment, I see where a question popped up. I want to make certain that we have this. Yep, we went through the OEP, and good thing we did it quickly because Jay's left. If someone who did not change their MA during AEP make a change on their MA during OEP? Yeah, Ronald, they sure can. They can do a switch from one to another. I kind of beat that one to death. I'm sorry. But most certainly they can, and that's there for them. These two programs can enhance that choice and create a special election period to move them into a more comprehensive plan in the future throughout the year too, should they need to do so. So once again, reviewing these SEPs, these are the ones we run across most frequently. We see people that are leaving group coverage for one reason or another, folks that are movers, where they've gone from one area to another, folks that are eligible for special needs plans or lose that eligibility. For those folks that we also see that have disenrolled during the OEP, so we're seeing some of those. And for those that might qualify for agent, basically is what this one is. And you hear a lot of talk about the 5-star programs as well. And this is a circumstance that is unique to certain areas because there's not a 5-star plan everywhere. When we look at that second option, and these are people that are voluntarily or involuntarily losing group coverage, these are folks that, according to timing with that circumstance, when they lost the coverage, we need to make certain that we have the underlying coverages in play to make them eligible for an MA plan, because some, if they're on a group, may have delayed enrollment in Part B, or sometimes even A if they don't work long enough. And we want to make certain that we use this to avoid any gaps in their coverages as they leave perhaps their job or retirement coverage or whatever it happens to be in this area. This is fairly frequently seen, and this is when a person moves, permanently changing their home address. It's important to note that if they sell their house in one part of a city and they move to another part of that same city, if they're in the same service area, this doesn't come into play. You also have to make certain that you see this more for someone who's moving from one part of the state to another or to another state. And we have a number of programs now too where if we don't track this, you'll get the app kicked back, and trying to sneak this one through just doesn't work. So we want to make certain that they're actually moving from one service area to another to use this one. We hear a lot of talk of the special needs plans. And there are actually 3 categories of special needs plans. They can help us in different areas if they're offered and if we're able to sell them. The chronic special needs plans, the C-SNPs, are for folks with certain health conditions. And these are the health conditions that have been set up by the government for these special needs plans. Now, just because they're listed here doesn't mean they're available in your area. And there's a different process for a person to go through and qualify for them. They have to have proof from a doctor that they have one of the conditions that are named in that special needs plan. You have a different prospect in this area, however. Just because they have a chronic condition doesn't necessarily mean they're sick. And so we're able to get them help on their base medical, dealing with them across the board. These still may be a prospect for you for other products, final expense, life insurance, long-term care, a number of the other things, depending upon how that condition is controlled. Might qualify them for an MA plan, might give you additional premium dollars there then available to sell them something else. The institutional SNPs, the I-SNPs, are for folks that are in an institution like a nursing home or require nursing home care at home. These generally are covered by captive agents for the different insurance carriers or agents that have gone through special training programs. They're not widely available, and in most cases, people will hear, boy, I can go market to nursing homes. Not necessarily. Just because they're in a nursing home doesn't mean there's an institutional SNP there. And even if there was, can you get paid for it? You also have a lot of talk, more talk in this area than anything else, conversations about dual special needs programs. And these are for folks that have both Medicare and Medicaid, or as we learned a little bit earlier, the MSP programs and how that may be appropriate for certain individuals. To be eligible for these plans, in a chronic SNP world, you got to have that chronic condition and the other pieces that come into play. The Medicare Part A and Part B, and residing in the service area in which the plan is offered. That chronic condition has to be in place, and that condition needs to be verified by their physician. So this gives them the opportunity to generate an SEP for this. The plan usually comes into play the first day of the month after the application's been completed. And so we see a lot of the same timetable come into play with the regular MA plans as to effective dates. Now, if that condition isn't verified within 60 days, they'll knock them off the plan. So you need to be aware of that. We also then have the dual special needs plans, which the proliferation of these plans has increased dramatically over the last couple of years. Additional carriers are getting into the space. The programs are becoming even more competitive when it comes to extra benefits. And to qualify for these programs, they have to have A and B. They have to have the required underlying entitlement program. Why'd I phrase it that way? Well, technically, someone with SlimB can enroll in a dual SNP plan, but it may not be their best choice to do so. And there are certain carriers out there in certain areas that will treat a partial beneficiary in that area, SlimB or QI1, the same way they would a QuimB or full Medicaid, and take up some of the difference. That's not a common occurrence. However, we need to be aware that in your market, that may be there. And so that's why it's important to have a expert in the area to help you, or someone who can research for you the plans in your area if you haven't been able to do so yourself, to make certain that, hey, this plan, that'll help them. This one, don't do that. To also speak to the disenrollment period during OEP, this goes back to the question we had from Ronald a little bit earlier, and a little bit of a synopsis that lays through what you can do with the OEP period. The also, I'm stuck on the word also today, it appears, but this tells us about the agents. And this is goes back to that whole proliferation of beneficiaries that are available for us and how we deal with it. The 5-star plans, there's a lot of talk about, gee, these highly rated programs, I got to get me some of that. Well, what you'll see in a lot of areas, the most common carrier that has a 5-star election period is Kaiser Permanente. And they are not widely available across the country. They are a huge player in certain markets. And one of the reasons why they have a lot of 5-star programs is their docs are employed for the most part, in many cases, and they can be asked to do many of the things that an independent physician may not be willing to do and can't be really kind of pushed into it by their contract. However, you will see these in certain markets. Here in Texas, we have them in every county in the state, because one of the carriers has done some really unique things in order to put that in play. But this is a program that they can use once a year and take care of it, enrollment into that 5-star plan. I neglected to say back on the chronic special needs programs, pardon me for just a second, where when you have a chronic condition, you can have multiple SEPs with a chronic condition, because many times the person will have more than one of the underlying illnesses. That's where it's important to use the producer help desk with the different carriers to find out which illness they used for their initial SEP. Going back, flipping back to that 5-star, this is a great marketing tool by many of the carriers, and is one of the things that we see agents use in their material, their mailers, or whatever else it happens to be, speaking to the availability of these programs. And hey, a kind of a variant of what we saw on television, are you using the best plan or what, and you're not supposed to use superlatives anyway. So what you'll also see on some of these, on how they affect some of the SEPs, affect some of our other programs that we offer, Medigap programs, Medicare Supplement programs. If you have someone with an MSP, it depends on what level of assistance they have as to whether or not you'd like to use that as part of your marketing for Medicare supplement plans. If they're a QuimB, you should not sell them a Medigap policy. They can kind of suspend their programs with that they have a Medigap if they're on QMB, if you reach them when that's how they've been doing things. But to go into a household and they have an MSP, you should not be selling them a Medigap policy. QMBs and QI1s, that might be a different animal. And it also affects how that beneficiary lives. That might sound really remedial, but if they're in the community, they're a community-based independent person, you have different ways of dealing with long-term care Medicaid, because it's a bit of a different qualification factor, and some people will get it confused. And if someone goes into a nursing home, a lot of times the primary payer for that is Medicare and Medicaid, different animal. They're a private pay, well, Medigap might still be a very solid option in that case. We also have a lot of confusion now with folks that are going from the marketplace into Medicare because of layoffs and other things that have come about with the pandemic. And then, of course, in the normal timeline of what's happening with people as they age off of their job coverage. We want to make certain that people know that there is overlapping enrollment periods in marketplace versus Medicare. Two programs are independent. Medicare has nothing to do with the marketplace. You can't be on both. And we want to make certain that any questions you have in this area, we have a different presentation that goes into greater detail with it, that gives us some of the answers you need. So that link will be available to you as well. When we look at how we can help people that are coming off of the marketplace, the health insurance marketplace, it's important for us to be aware of all the options that that individual has, that we're working with everyone that's involved in the decision-making process, which we do generally across the board with people we speak to, but how we can make this work for that individual. Because sometimes a person will have their dependents on their group coverage, and how does them coming off group coverage and or off of the marketplace deal with the coverage for the rest of the family, and how we can make that work. It's important to know one size doesn't fit all. Our preferences come to mind in some of the ways that we present, but we want to make certain that the folks that we visit with have the information they need to make the decision that is best for them. Sometimes that's tough to step back and realize that misspelling split gives us the opportunity to speak to one size not fitting all. Why do you want to deal with all these programs and all this opportunity through us here at Premier? Well, there are different things that we do that can help you through this process. If you're new to the Medicare space, we recommend that you put an agent profile up, insurance-based, so you gather all your information there. This gives you an opportunity to electronically contract with a number of carriers without filling out a bunch of paper. And one of the things that we see across the board in our world now is the less paper, the better, for the green initiative, but also because in many cases they can't read our handwriting, and or we might miss a page where it required a signature or initialing on some of the paperwork. Many of the carriers now have their own electronic contracting systems where you have an individual link sent out to you specifically for that. But we want to make certain that we're accommodating your needs across the board and handling the contracting process as quickly and as accurately as possible too. We do offer discounted errors and omissions coverage for qualified agents. What makes you a qualified agent? You have a contract with us. But this is a program you own. So it's not like being added to a blanket policy for one program or another, and you got to figure out how you're going to get yourself covered for the rest of it. Well, this covers you regardless of whom you contract through and the product that comes into play. You'll see in this area too that it actually handles some of the variable products, which is an area where it's becoming increasingly difficult to get your coverage in this area. So E&O is a possibility, and we do offer bundled continuing education courses to help keep your license in play through our relationship with WebCE. Great programs that are out there for you to do things online and take care of that requirement. You do also have the possibility of adding to your own benefit structure through yourself through a modified guarantee issued DI program, disability income plan, where you share in the commissions in this product. So if that's something that you've been considering for yourself and you might have some health concerns, well, this might be the best way to get that coverage and get paid on it. Much as where today's presentation is being recorded, past presentations have been available as well, recorded and are available as well. And you'll see that they are on our website and on our YouTube channel. So they're available 24/7. You can go in there. In addition to concepts, We speak to and we record programs from different carriers or different product types or different marketing initiatives that are there for you. Great way to get caught up on and pick up a hint or two that can make a difference in your income. This is a program we cannot spend enough time on, and don't worry, I know I'm getting close to the top of the hour. I won't spend a ton of time on it, but we have different programs out there that can help you grow your most valuable asset, which is your time. And this is one that's available to our contracted agents without cost. As an old MA agent, I still have a hard time using the word free, but Medicare Center is a program developed by Integrity and Premier to give you tools to remotely enroll people, along with a number of other things. It's got a universal login for 3 different quote engines: Medicare App, Medicare Link, and CSG. So you've got the engines powered by Connecture, Sunfire, and CSG, all available through that single login. It gives you then the opportunity to collect that scope of appointment electronically by one means or another and store it for that 10-year period, whether you sell it or not. Utilize the CRM that's built into the system so you can market to your folks throughout the course of the year and do annual reviews. A great way then to help you cross-sell. And it has other resources within it as well, different hints and tips, sales scripts, and those sorts of things that are part of the system. What's it cost you? You're contracted with us or one of our Integrity platform partners, doesn't cost you a thing. And one of the things that's in there now that's particularly pertinent for us is through the CSG tool, you have the opportunity to fill in the gap. I think this is a wonderful piece that you go into a household, you're examining their coverages, their base coverages. They've got an MA plan they're happy with. You're not going to move them off it. They have a hospital copay in it. You can pull up that plan and you can plug in details on hospital indemnity programs, HIP programs through this, and it'll calculate it for you through the different carriers, the multitude of carriers that are available in the system. Great way to cross-sell. Many programs too offer different initiatives. We want to make certain financial initiatives. We want to make certain that you're paid everything that you're entitled to. So that doesn't apply in many cases to MA and PDP programs because the max comp for those is set by the government. But Medicare Supplements or Ancillary Programs, there's a ton of incentives out there. Some of the monies that can be made through these incentives on MedSup are a bit mind-boggling also. And they may help you also qualify for different trips those carriers put into play and help you qualify for different incentive programs here at Premier as well. We do also want to help put you in front of people in order to sell all these wonderful programs. Take advantage of the special election periods that are out there for your prospects and clients and yourself. If you're interested in dealing with Ma Bell, we can get you contact lists available, butted up against the do not contact list at very reasonable prices, or none at all, depending upon your contracting situation. We also help you with sales tracks to work through centers of influence in your community. Retail marketing programs. There are some that will continue after the first of the year. Kroger's got a big program out on it. A Walmart, there may be opportunities in certain areas. But this also gives you ideas as to how you maximize your return on participating in that program. And then how you access other centers of influence, such as the faith-based community or the folks that are delivering on the care for the programs you're selling, the providers. We have sales tracks and other programs out there that can help you be more comfortable in the pursuit of that business through that area, but also ways of making it more effective to you. If you've worked with different carriers now through AEP, different MA carriers, they may also have carrier-generated prospects to help you throughout the year. It's a symbiotic relationship. You can't get a new contract with somebody and say, hey, give me all your leads. It's not going to happen. But if you have the opportunity then to further your relationship with those carriers, they're going to help you with it. We do offer internet lead and direct mail support. We have a really cool T65 Locator program, and then a piece that talks about how you can maximize your referrals. So no matter where you get the initial lead, can you take that and grow it into a tree of people to see? That co-op program for leads, through direct mail, well, it's based on production, but you can qualify twice each month, once through health co-op and through final expense. So you can get up to 2,000 pieces of mail at reduced rates, so you can do it consistently. And we offer that through vetted vendors because we want to make certain that things are happening compliantly, but we also want to make certain that these people treat you properly. They all have great CRM programs, so as soon as a lead hits, you're notified and you're able to get to them when they're really, really hot. Great way to take advantage of the tried and true direct mail program. A lot of that depends on consistency. It's like exercise. I say that as I look down at my big belly, but if you do it consistently, you're going to see the benefits. If you do it once or twice, you're going to feel a little bit of the pain, maybe a little bit of result, but it's consistency that's the key. We also have a program in play that can help you with direct mail response that's never been touched, or you're buying just responses. The cost of these programs will vary from area to area and from time of year to time of year, law of supply and demand, but there are different ways that you can access Medicare leads through the YIG program. The internet programs that we have, well, they're Facebook programs. There's one that comes into play for final expense and one for Medicare. These are more microwave in nature, where you can get a response very, very quickly, but it's also one that expects a response from you very, very quickly as well in order to maximize the value of these leads. Great way to plug in additional appointments on your calendar, however. At T65 Locator, this is for a lot of laying it in for final expense or Medicare supplement plans, because this is telling you where people live in the community. And if you're one of those outgoing type A's, you can door knock and be compliant with it in those two areas. So this is going to give you the opportunity to do that. It too is available without cost to our contracted agents. We put all this in play because we want your business. Much as where you're out there helping the community, our interpretation or our add to there is helping you help that business. And so we ask for your business as well. The referrals, well, not only do we ask you to engage your current book of business, but we ask you also to visit with fellow agents and then refer us. We'd appreciate that to a great degree. So the vast amount of information we gave you very quickly here today. I was telling Brandy before we started, maybe I should have backed off on that 5th cup of coffee, but it's one of those things where you don't have to wait to put this in play. Now is the time to do it. So as John Wayne said in the movie The Cowboys, slap a piece of bacon on that biscuit, saddle up, let's ride, because we're burning daylight. This is something you need to do now and be active in the Medicare space, regardless of what products that you offer to this population. All that said and done, you can reach us through our toll-free number at 1-800-365-8208, through our website, and in response to the email we send out, and in your communications with your marketer that you have here with us here at Premier. If you haven't a marketer assigned to you, dialing into that number, he'll put you in touch with a person that will help you across the board. So it's a great way for us to make certain that we're taking care of you throughout the year as well. At this point in time, all I've got left to say is thank you. I want to thank you for the investment of your time with us here today, your most valuable resource. For those of you that are on the program that's done business with us, we thank you for that business. And for those of you that are considering doing business with us, we welcome that opportunity and thank you for doing so as well. And so until we're able to speak with you here again, I want to thank Brandy to come in, or thank Brandy for helping us today. I want to thank you once again for coming on. Until we visit with you again, I wish you good selling. Thanks so very much. We'll talk to you soon.